Most of us, at one time or another, will complain of pain in the abdominal region. Fortunately, in many cases, the cause is benign and there is no need to worry. However, abdominal pain can also be a sign of kidney disease. While a renal colic is usually a very painful and a traumatic event, inflammation of the urinary tract is associated with a much milder degree of pain and with fever. Ultrasound is by far the most commonly applied imaging technique for the detection of renal diseases. It is quick, cost-effective, and allows visualization of the kidneys and the urinary bladder. Combining the findings obtained with ultrasound with the patient's history and laboratory results is usually enough to establish the diagnosis. All this is possible without exposing the patient to radiation. Clearly, ultrasound has dramatically changed the way we approach patients with urinary tract diseases. In the following lecture, Professor Dirk Becker from the Agatha Reid Community Hospital, an academic teaching hospital of the Ludwig-Maximilians University of Munich, will explain how ultrasound can be applied in a primary care setting with a focus on imaging the kidney.
There are several potential different causes for acute abdominal pain. The stomach could be affected, the biliary system, the kidneys, the liver, the pancreas, and also the abdominal aorta. I would like to talk about the kidneys in the next lecture. Where to find them, where to look, what is right and what is wrong. The anatomy of the kidneys is depicted on this image. The kidneys are lying in the retroperitoneal space on both sides. The right one located behind the right liver lobe, the left one located behind the stomach, behind the colon. Now, how does a normal kidney look? It has a normal size, which means the length, diameter, is 9 to 12 centimeters, and the thickness of the parenchyma is at least 1 centimeter. You do not see in a normal kidney any fluid collection within the center of the kidney, and you do not see any stones or shadows from stones, and of course you do not see any renal masses. But where are the kidneys? Where do we find the kidneys in the human body? Let's take a look at the anatomy model. We removed in this torso all organs which are in the way. And as you can see here, the kidneys are located in the retroperitoneal space at each side of the human body. To scan the kidneys, you have to do lateral views from both sides to avoid the bowel gas. Do it longitudinally, like that. To scan the whole probe by moving the probe back and forth, median and lateral, and then turn the probe counterclockwise to make a transverse scan of the right kidney by moving the probe down and upwards to scan the whole organ. The same is on the left side. You start with the longitudinal view, scanning the whole organ median and lateral, turning the probe 90 degrees counterclockwise, and then moving the probe up and down. Especially for the scanning of the left kidney, it can be very helpful if you ask the patient to turn around so you have the possibility to avoid the bowel gas on the left side. Now let's take a look at some real ultrasound images. At first, I wanted to show you the position of the probe. That is the probe position for the longitudinal view of the right kidney. And here we have the position for the probe longitudinal view left kidney. Turning the probe 90 degrees counterclockwise, we have the position for the probe here for the right kidney and here for the left kidney. This is how it should look like when the patient is lying on the back. Probe is positioned here, and here you have the image, right liver lobe and the right kidney. In the transverse view, turning the probe counterclockwise, Here we have the right kidney. And this is how it should look like in the movie. You have the right kidney moving up and down when the patient breathes, and the right liver lobe moving much more than the right kidney. Transverse scan on the right side, the movie with the right kidney over here. Very important to mention, do not leave the probe on one position. Move the probe in the transverse scan up and down to scan the entire kidney on both sides. Very important, not staying on one point. In longitudinal view, go from lateral to medial, and in the transverse view, from top to bottom for the entire organ. For imaging the kidneys in the primary care ultrasound setting, we are using this primary care ultrasound device equipped with a dual probe. A linear probe on one side and a phased array probe on the other side. We are using the phased array probe for imaging the kidney, and this notch on the probe shows us the cranial direction when scanning the kidney longitudinally. Now I would like to demonstrate how to scan both kidneys. We are starting with the right kidney, the patient lying in a supine position, and we can visualize the right kidney in a longitudinal and a transverse view. Here we see the right kidney in a longitudinal scan through the right liver lobe. We have to tilt the probe medially and laterally to visualize the entire kidney. Then we turn the probe 90 degrees counterclockwise to get into the transverse view, and again we have to tilt and here also to move cranially and caudally to image the entire right kidney. We do not see any fluid in the center of the kidney, no fluid around the kidney, and that is just a normal situation. Now let's try to visualize the left kidney. The left kidney is sometimes a little bit harder to visualize than the right kidney due to the bowel gas and the gas in the stomach. We first position our probe longitudinally at that point. As there is no kidney visible, so please inhale deeply. And that is the trick. Here the left kidney comes into our field of view, and we can tilt the probe medially and laterally and visualize the entire kidney. And exhale. Now we turn the probe 90 degrees counterclockwise. Please inhale deeply. And here, the same thing in the transverse view. We tilt the probe caudally and cranially and have a nice view onto the entire kidney. And exhale. Thank you very much. Sometimes the kidneys are not visible from the supine position. In this case, you have to ask the patient to turn. I will show you the image acquisition of the left kidney. So please inhale deeply. And here you see the kidney moving from the top to the bottom, so into your field of view, and you get a real nice image of the left kidney longitudinally. And please exhale. We turn the probe 90 degrees counterclockwise to acquire the transverse view. Please inhale deeply. And again, we have to tilt the probe caudally and cranially to acquire the whole kidney view. And finally, I will show you the right kidney from the same lateral position. Please inhale deeply again. Longitudinal view and exhale. And please inhale again. And the transverse view. and exhale, please. Thank you. We completed the visualization of both kidneys. We can say this young lady doesn't have any kidney stones, no fluid collection within the kidneys, and no renal masses. Now let's take a look at some very important pathologies in the kidney. Primary care ultrasound, when scanning the kidney, is very useful for the detection of fluid collections, for the detection of stones, and of course for the detection of renal masses. Here you see a fluid collection in the kidney. That gives you a hint that there is some urinary obstruction between the kidney and the urinary bladder. Here, in combination with a cyst, is a shadow coming out of the kidney, showing you a stone which is located here. And here, very important, not making any pain at that early stage of the disease, a renal mass here in the right kidney, and here, better visibility in the movie. But in addition, I would like to show you some other very important clinical images or situations which you have to be aware of. That is the typical image of a chronic renal failure. That would always lead to a laboratory finding which shows you the degree of the renal malfunction. This, of course, doesn't cause any pain to the patient, but can affect the patient when contrast medium is applied. A very common pathology, which doesn't cause any harm or pain to the patient, is a renal cyst, which is depicted here. These cysts are only harmful to the patient when they are very large or they show signs of inbleeding, and then they can cause pain. But this here has not to be misjudged with a fluid collection in the kidney. This is a depiction of multiple peripulvinic cysts, which can be misjudged as a fluid collection and lead you into a wrong direction.
Dirk showed you a lot about normal findings and standard views, even a pathology. Let me show you some more clinical cases out of my daily practice. A 22-year-old female enters the office. She complains of massive back pain and high fever and nausea. She has no medical history, she takes no medication, she's not drinking, and she's a non-smoker. In the physical examination, she states diffuse abdominal pain, but the most painful part is her left flank. Again, she has high fever, the rest of the physical is completely normal. Because of the back pain, flank pain, and the high fever, I was worried about her left kidney. Therefore, I performed a point-of-care ultrasound. Here you can see a longitudinal plane of the left kidney, and immediately you see that there is something wrong. As you can see here, there is a dilatation of the renal pelvis present and the renal calyces, and again here, dilatation of the renal pelvis and the renal calyces. This already is hydronephrosis grade 2. But what is the cause actually? I added color Doppler to prove that there is no flow, but as you can see here, because of this massive pain, the patient was moving a lot, therefore we see a lot of artifacts. I also performed a transverse view of the left kidney. Here again you can see a dilatation of the renal pelvis, but again, the cause is not visible. This girl was transferred to a urology department with hydronephrosis grade 2 and high fever with the diagnosis of a pyelonephritis. At the urology department, a renal pelvis calculus was diagnosed. The problem of a renal pelvis calculus is that it is nearly not visible with ultrasound, even impossible to visualize with point-of-care ultrasound. To see the difference in between the pathologic kidney and the normal kidney, here is her left kidney with the dilatation of the renal pelvis and the dilatation of the renal calyces, compared to her completely normal right kidney with no dilatation of the renal pelvis or the renal calyces. Even though we did not find the underlying cause, if you put together the findings of point-of-care ultrasound and the physical status of the patient, and if you put together all those puzzle pieces, you will get the right diagnosis and the right treatment. A 71-year-old male patient comes into your office with dysuria and polyuria. He has no medical history at all. Immediately, a urine test strip is performed. It is positive for leukocytes and nitrates. In the physical examination, he experiences a little bit of flank pain on both sides. The diagnosis is quite clear: cystitis. Still, because of the flank pain, we have to think of a pyelonephritis. Therefore, we have to perform point-of-care ultrasound. I started rather medial with my examination in a longitudinal plane. The first view I got is a longitudinal plane of the gallbladder. Here you can see the gallbladder and the left liver lobe. To get a good view of the right kidney, you have to move laterally and dorsally. Here you can see a longitudinal plane of the right kidney, in the center the renal pelvis, and here you can see the renal parenchyma. I could not find any signs of pyelonephritis, no stone or a dilatation of the renal pelvis. Actually, I found a simple cyst, this echo-free area over here with the dorsal acoustic enhancement. We have to take a look at both kidneys. Here, the right kidney with the simple cyst and the left kidney. No dilatation of the renal pelvis and no stone, but some simple cysts over here and over here. I treated this patient with antibiotics and called him again 3 days later, and he felt just perfectly fine. A 74-year-old male patient complains about back pain since 15 years. He states that he takes sometimes painkillers. He has no other medical history at all. He consults a doctor now because of his progressive dyspnea, fatigue, and beginning leg edema. Fatigue, progressive dyspnea in combination with painkillers should raise a red flag. I will tell you shortly which organ you should think about. But because of his dyspnea, I started with a point-of-care ultrasound of his lungs. And I was not surprised, as you can see here, already pleural effusion present on the left side with atelectatic lung tissue, and on the right side, pleural effusion too. I asked him for how long did he take those painkillers. He stated for several years now, even daily. And he took ibuprofen, acetylsalicylic acid, and diclofenac. All of them are NSAIDs, non-steroidal anti-inflammatory drugs. And all of them are nephrotoxic. Therefore, point-of-care ultrasound of the kidneys is indicated. Here you can see his right kidney and his left kidney. Normally, you can compare the echogenicity of the renal parenchyma to the liver parenchyma. They should be nearly similar. In his case, because his kidneys were very atrophic, the kidneys are hyperechogenic. Because of this long year use of NSAIDs, he got acute renal failure. There are two more organs you have to think about if you see such kidneys. First is the lung. We already seen pleural effusion present in this patient. The second organ is the heart. This patient even had pericardial effusion, seen over here. It is very important to listen to your patient and to take a complete medical history and make use of point-of-care ultrasound. I referred this patient to nephrology department. They started dialysis immediately. After these 3 interesting cases, which showed the great value of point-of-care ultrasound, let's hand it back to Dirk.
For me, in my daily clinical routine, besides endoscopy, ultrasound is the most important tool for every patient in my daily clinical routine. Primary care ultrasound is the perfect imaging tool for an exact and quick diagnosis at an early stage for every patient.